A new survey out of Jefferson County found 91% of respondents want to get the COVID vaccine when they're able to. However, that same study found out that not all parts of our community have the same comfort and access to the vaccine. So Rob's here to break down what the survey can tell us about who is and isn't getting the vaccine and why. Good morning, Rob.
Hey, Daniel. Yeah, so it's important to say that this survey was voluntary. The University of Louisville and the Community Project sent letters to almost 36,000 people, inviting them to log on to a survey and then complete it online. But at that point, it was entirely up to the recipients to decide whether or not to participate. Still, the researchers say that they learned some important things that will help them to make sure the vaccine access is as equitable as possible. So the headline here you heard Daniel say, a vast majority of respondents say they would choose to get a COVID vaccine, 91%. And a little more than 90% of respondents also said they have not yet been vaccinated. So that means there are a lot of people in Jefferson County who want a vaccine but haven't been able to get one yet. However, the survey also highlighted a disparity we have seen emerge during the pandemic. Minority respondents were more likely to feel hesitant towards the vaccine. 8% of minority participants said they would never choose to get vaccinated, compared to 3% of white participants.
On a certain level, Black Americans have been traumatized. So even if you are presenting some people with, this is the data, we're showing that it's safe and effective, that's not enough.
Vaccine hesitancy among Black people may be part of it, but I think we also have to consider whether it's how we're signing people up.
And what you just heard from Councilman Bill Hollander is something that was mentioned in the survey. Minority participants were less likely to know where and how to sign up for vaccines. The survey did identify a few key things we can address to help people feel more comfortable getting vaccinated. That's one of them. Also, vaccine hesitant respondents said they were more concerned about side effects and safety of the vaccine. And even though the vaccines are free to get, more than half said they were concerned about potential costs. So education there would be important too. It's also important to know that since this survey was voluntary, the respondents were skewed. They were more likely to be older, female, and white than the general population. And that actually mirrors the vaccines that have been given in Kentucky so far. This graph shows you the age breakdown, and as you can see, the 70-plus group has the most vaccines. If you look at the racial breakdown, you can see that white people have been vaccinated more than any other race in the state. And then with gender, the state reports that more women have been vaccinated than men as well. Daniel.